COVID researchers have been revealing the often devastating consequences patients have faced during and after hospitalization. In a new study of nearly 150 patients hospitalized for COVID at the beginning of the pandemic, it was found 73% had delirium, a serious disturbance in mental state which may cause a patient to become confused, agitated and unable to think clearly. The patients with delirium tended to be sicker, with more conditions like high blood pressure and diabetes, said study author Philip Vlesides of the Department of Anesthesiology at Michigan Medicine. They also appeared to have more severe COVID-related illness. COVID is also associated with a number of other adverse outcomes that tend to prolong hospitalization and make recovery difficult, he added. Using patient medical records and telephone surveys following hospital discharge for a group of patients hospitalized in the intensive care unit between March and May 2020, the study's researchers looked to identify common threads amongst patients who developed delirium. Bowel cancer symptoms, the sensation when having a poo that can be a sign several factors are at play, said Vlesides. Delirium can lead to reduced oxygen to the brain, as well as the development of blood clots and stroke, resulting in cognitive impairment. Inflammatory markers were found to be greatly increased in patients with delirium. Confusion and agitation could be a result of inflammation of the brain. Do you pee in the shower? Doctor explains why you should give up the habit immediately. Exclusive fatty liver disease, signs when you go to the toilet that need urgent medical attention, expert advice. Diabetes, the red drink that lowers high blood sugar levels within 15 minutes of intake, insight. In addition, care teams often were unable to perform standard delirium reduction techniques, such as exercises designed to get a patient moving or allowing visitors or objects from home to orient patients while in the hospital. Vlesides said, early on in the pandemic, we weren't performing standard delirium prevention protocols like we usually do. A big reason for that is early on in the pandemic, in the pre-vaccine era, we had limited personal protective equipment and were trying to limit COVID exposure and disease transmission. The study found cognitive impairment can persist even after discharge. Almost a third of patients didn't have their delirium marked as resolved in their chart upon leaving the hospital, and 40% of these patients required skilled nursing care. Almost a quarter of patients screened positive for delirium based on assessment by their caretaker. For some patients, these symptoms lasted for months. Overall, this study highlights another reason why getting vaccinated and preventing severe illness is so important, concluded Vlesides. There can be long-term neurological complications that perhaps we don't talk about as much as we should. Delirium is also described as sudden confusion. The NHS states if a person is confused, they may not be able to think or speak clearly or quickly know where they are, feel disorientated, struggle to pay attention or remember things, see or hear things that are not there, hallucinations.